Welcome to Part 1 of Chapter 5, The Physical Examination of Urine. The study of urine is the oldest clinical laboratory test still performed today. Historically, only the physical characteristics of urine were evaluated because we didn't have means to test it chemically. So the urine was observed for color, clarity, odor, they sniffed it, and taste. They actually tasted the urine. This has not been performed for centuries because we do have chemical tests now to assess the sweetness of the urine. And another interesting fact is they used to pour urine of suspected diabetic patients near an ant pile, and a positive test was when the ants went to the urine and carried off the glucose. Physical characteristics play an important role as they may indicate that disease processes are present, or they may indicate the presence of abnormal urine components. Normal urine colors are various shades of yellow. Other colors that you may observe are amber to orange, red, green, blue, brown, or even black. Color variations can indicate the presence of a disease process, a metabolic abnormality, or ingested food or drugs. Color variations can also be a result of physical activity or stress. In patients, a change in urine color is often the initial reason they seek medical attention. I've told my children from the time they were very young, look at what comes out of your body, and if it doesn't look normal, let me know. And several times this has set us on a path to go to the doctor because of a urinary tract infection. The normal color of urine is yellow, and this is due to the pigment urochrome. Urochrome production and excretion are constant. The intensity of color provides a crude indicator of urine concentration and body hydration. If the urine is dark yellow, this indicates a concentrated urine, and this is usually due to a decrease in water consumption or loss due to extensive vomiting and/or diarrhea. A pale yellow urine indicates a dilute urine, and this is usually due to increased water consumption. There are two other pigments that contribute to the urine color, and that is urobilin, which is an orange to brown pigment, and uroerythrin, which is a pink pigment. Standardization of the terminology for urine color varies among different labs, and by having standard terms in your laboratory reduces the ambiguity in color interpretation and improves consistency among the staff. In the old days, we used to use terms such as straw and beer brown, but these should be replaced with color terms such as light yellow or amber. Bloody is descriptive, but it is not a color. Red or pink is more appropriate. Normal colors may contain significant pathologic elements, and an abnormal colored urine may be completely normal. So you cannot just assume based on a urine's color that this is a clinically significant finding until you do additional testing. Standard terms used to describe urine color are found in the laboratory's policies and procedure manuals and must be available and used by all personnel. I love this picture because it gives you examples of the urine color and the terms used to describe them. So we have light yellow, yellow, amber, red, and brown. But there are a lot of other different colors that urines may have. Many substances are capable of modifying the color of normal urine. The same substance can impart a different color to urine depending upon the amount of the substance present, the urine pH, the structural form of substance, which can change over time. It's very important to observe color of fresh urine. For example, red blood cells is a structure that may be found in urine. In fresh urine, the color may be pink or red depending upon the quantity of red cells present. Over time, red cells will disintegrate, hemoglobin will be released, and it may be oxidized and result in a brown or black urine. Glomerular or tubular damage may allow red cells to enter the urinary tract, become oxidized in the bladder, and then the patient will produce a brown urine. So again, it's very important that when you get a urine in that you analyze it as quickly as possible, especially for the physical characteristics. I want you to spend quality time with tables 5.1 and 5.2 on page 70 to 71 in your textbook. This is an extensive list of causes of changes in urine color. Some substances that change the color in urine may indicate the presence of pathologic conditions. For example, the presence of blood or myoglobin may be indicated by brown color in fresh urine. Bilirubin has a yellow color, but when significantly increased, it has an amber color. Upon standing or improper storage, the bilirubin oxidizes to biliverdin, and this causes the urine to have a greenish hue. And one caution about amber-colored urine. Be sure, of course, that you're always wearing gloves, but when you swirl it, because before you do chemical testing, you need to swirl it and make sure all the elements are suspended in the urine. You will notice that the yellow color will coat the sides of the urine container. Usually this indicates that the patient has hepatitis. Now, there are many kinds of hepatitis, but just, again, I handle these with even more extreme caution. Urobilinogen is normally a colorless constituent of urine, but due to oxidation, urobilin may change from orange to brown. And this is due to, again, either improper storage or standing. Porphyrins are colorless substances which are a solute found in the urine of patients with abnormal porphyrin metabolism. Porphobilin oxidation of porphobilinogen imparts a pink color to the urine. Melanin, indican, and homogentisic acid are also substances that may indicate a pathologic condition. Ingestion of certain substances will cause changes in urine color. Certain medications, dyes in food coloring, vitamins, especially vitamin B, will turn the urine bright yellow. Pigmented foods, such as fresh beets, may turn the urine pinkish. There's a medication, phenazopyridine, that imparts a distinct yellow-orange color which frequently interferes with the interpretation of colors on a dipstick. I've done urinalysis on these samples. When you dip the urine in, the pads turn these bizarre colors, and the instrument can't analyze them. And you can't even do it with your eyes. And usually we will just say that due to interference with the color, we cannot do a chemical examination of the urine. And the doctor may want certain specific tests done that may have to be done by a different chemical method. I found this chart on the internet, and I thought it may be of interest to you because it shows you the different colors of urines and the causes behind that color change. Foam is usually not a procedure that's done, but just out of curiosity, if you shake a normal urine, it will produce a white foam, and that white foam rapidly dissipates. The characteristics of urine foam, the color of it, the ease of formation, the amount produced, are modified by the presence of protein and bilirubin. When you shake a urine and you get large amounts of a stable white foam, this indicates a large amount of albumin, which is a protein, is present in the urine, which is not normal. Yellow foam is caused by increased bilirubin, and again, bilirubin indicates some type of liver damage. This is not normally included on report forms or done. Substances which cause foaming will be detected during the chemical examination of the urine. I wish they had put a white background behind the urine on the left, because this is an amber colored urine, and if you note, they have shaken it and there's a large amount of yellow foam on top. So this indicates a high bilirubin concentration. On the right is a urine that's been shaken and there's a large amount of white foam. And this indicates a high concentration of protein, specifically albumin, in the urine sample. Clarity is often called turbidity, and clarity describes the cloudiness of a urine caused by suspended particulate matter that scatters the light. It's assessed at the same time as the urine color, and you'll refer to your laboratory policies for a list of terms to use to describe the clarity. Normal urine samples are clear. Freshly voided clean catch urine is normally clear. If precautions are not taken during collection, A normal sample can become cloudy due to contamination from skin or vaginal secretions, from bacterial growth in the urine, or the presence of fecal material in the urine sample. Some other causes of cloudiness include precipitation of dissolved solutes, X-ray contrast media, red cells, white cells, epithelial cells, clots, bacteria, cast. So the bottom line is, when you see a cloudy urine, you will expect during the microscopic examination that there will be significant numbers of components present that are visible under the microscope. I love this picture, and I wish it would be included in every urinalysis textbook. This is an illustration of urine clarity and the terms used to describe it. If you hold newsprint behind a urine and you can clearly see the type, that is a clear urine. If you can see some of the type behind it, that's slightly cloudy. If you can see tiny portions of the newsprint, then that is cloudy. If you absolutely cannot see any of the newsprint, then that is turbid. Amorphous urates and amorphous phosphates are caused by the precipitation of crystals which are present in the urine. Amorphous urates are found in acid urine, and they're pink in color, and they're similar to red brick dust. Amorphous phosphates, they're found in alkaline urine, and they are whitish or beige in color. Usually they are enhanced by standing at room temperature, or being placed in a refrigerator for an extended period of time will enhance the formation of these precipitates. Part of the urinalysis involves spinning the sample down in a centrifuge, and on the Part A, you can see amorphous urates. Again, I want you to know these are present in acid urines, and they have a pink color similar to brick dust. B, this is amorphous phosphates. These are found in alkaline urine, and they usually have a whitish or beige color. Usually you don't see this amount of urates or phosphates in spun urines, but these are really good examples of what they look like. There are a variety of substances that can cause reduced urine clarity, and these can be categorized as pathologic or non-pathologic. If a substance is considered non-pathologic, these are usually either contaminants or normal urine components. For example, it is not unusual to find spermatozoa in the urine of a man. But if you find this in the urine of a female child, this is cause for concern, and this is a totally different subject that will be addressed later. Radiographic contrast media. Large number of squamous epithelial cells or fecal material indicates improper collection. Now keep in mind, squamous epithelial cells are a normal find in the urine, but if you see a lot, this usually indicates that it was not collected properly. Pathologic substances in the urine indicate deterioration of barrier that normally separates the urinary tract from blood. You should never have blood in your urine. Disease processes or metabolic dysfunctions. Some pathologic causes of turbidity include red cells, which may indicate glomerular damage. And I do want to share a story with you that my dad, later on in life, he had a urinalysis done, and he had red cells in his urine, and he had been losing weight, but other than that, everything was normal. Well, it turns out that he had bladder cancer, and so red cells in the urine, again, these are not normal, although you may find them as contaminants in a urine of a woman who is menstruating. White blood cells, they may indicate a urinary tract infection, also known as a UTI. In fresh urine, the presence of bacteria, white cells, and casts, which we'll discuss later, indicate upper urinary tract infections, the renal pelvis, whereas the presence of bacteria and white cells without pathologic cast implies a lower urinary tract infection, a bladder infection. Yeast and trichomonas is a parasite, are infectious agents that are present as a contaminant from the vagina. Historically, urine odor has led to the research and discovery of phenylketonuria, a very rare inherited disorder. Urine odors are not documented. Historically, urine odor led to the research and discovery of phenylketonuria, a very rare inherited metabolic disorder. Urine odors are not documented unless they're unusually strong or very distinctive. Normal urine has a characteristic distinctive odor. Urine on standing becomes odorous due to bacterial conversion of urea to ammonia. Normal urine in the urinary tract is sterile. There's no bacteria. As it passes out of the body, it becomes contaminated with normal bacterial flora, which rapidly multiply in an improperly stored urine. And this results in an odorous urine. And you haven't lived until you open a container that has been sitting on the floor improperly stored for several hours. Patients with a urinary tract infection can produce an odorous urine because these bacteria have been baking in the bladder and multiplying rapidly, converting that urea to ammonia so that when they do urinate, this will have that odorous smell to it. That's why it's important to analyze urines quickly or store them properly. I want you to spend some time with Table 5.4 on page 74 that has a comprehensive list of the causes of urine odor. So, ingestion of certain foods or drugs change the odor. Asparagus, garlic, onions, IV medications containing phenolic derivatives. So I want you all to take a urine cup home and eat all of these foods and then pee in the cup and see if you have a distinctive odor. I've tried this and usually apparently I don't make an odorous urine. But again, just for fun, go and do an experiment because you are a budding scientist. Unusual odors of some metabolic disorders, such as increased fat metabolism, produces ketones, which have a fruity smell. What's still popular now is the low carbohydrate, high protein diet. When you're on a high protein diet, you will increase the metabolism of fat. This produces ketones, and people buy keto sticks and they test their urine. And when they're in ketosis, this is a sign that the diet is working. But be aware, everything in moderation. One of my doctors had a patient that ended up in the hospital because she was doing this so well and for so long, it started affecting her organs. Some of her organs were going into failure. So again, everything in moderation. Phenylketonuria, the urine has a mousy smell. I want to ask you this. Do you know what a mouse smells like? I don't. So they do describe this as a mousy smell, and I guess if you've smelled enough of them, you would be able to recognize that. Maple syrup urine disease, believe it or not, these patients' urine smells like maple syrup. We mentioned taste for historical purposes only. So around 1674, urine was tested to detect the presence of urinary sugars because these urines would taste sweet. And diabetes comes from the Greek word to pass through or siphon and refers to the excessive amount of urine excreted by these individuals. Excessive amount of urine. That's what diabetes means. The terms mellitus means sweet, and insipidus, which we've talked about before, means tasteless. And these were assigned to the disease diabetes because of the taste of the urine produced. So despite the similarity, the causes of these disorders are entirely different. Urine is no longer tasted. Aren't you really happy about that? Because glucose can be detected through chemical tests.